Hi, I'm Dan Callahan from WCCO Radio, and I'm here with Stephanie Schmidt from Pfizer. Stephanie's a sales rep. Tell me what you do for Pfizer.
I call on outpatient clinics in the Minneapolis and St. Paul area. I go in to talk to doctors and medical staff about the products I represent for Pfizer.
So when you do go in, what would you be talking to them about especially?
I would be sharing with them the latest research on medications I carry. Sometimes I'm talking with them about medications that are so new they may not know everything about that medication. Other times I'm talking with them about medications they're familiar with, but I may have a new study, new research to educate them on that product. I'm trying to give them information they need to make the best decision for the patients that they are seeing so that they can prescribe the medications that they feel are best for the patient.
Now, these normally people you've dealt with in the past?
Yes.
For the most part?
Yes, for the most part, unless a physician is brand new to the practice. They're people that I have known over the years.
So they'll know. That makes it just a little bit easier to get in there and maybe get their attention?
Yeah, it might make it easier.
Is it harder now to get time to see these people and get them to sit down with you?
Mm-hmm. It is. It's more challenging than ever. Doctors have many demands on their time. Medical technology is always changing. There are always new medications coming to market, and it's hard, very difficult for doctors to keep up with all the information available, all the journals that they have, everything that's new. I try to come in and be as efficient as I can with their time, with their patients' time, and present my information in an efficient manner so that they have that information available to make the best decision on which medication to use with the patient.
Now, you haven't used the word sell in there anywhere, and you're called a sales rep, yet that's not what you're doing there. You're there to educate, aren't you?
I am there to educate. I'm not selling anything directly. Obviously, I believe Pfizer makes some of the best products on the market, and it's my job to share with physicians and their staff the advantages of Pfizer products. But in the end, the decision is up to the doctor and the patient, which medication that they feel is best for the patient. And if that's a Pfizer product, that's great. If that's a product made by another company, that's great too. It's just best when the doctor has all the information and all the options available to choose from so that they can make the best decision for the patient.
Now, as a pharmaceutical rep, I guess is for lack of a better term, what wouldn't I know about your job that you'd like people to know?
Well, most people might not know that all pharmaceutical reps are very highly trained. We are trained to talk about all aspects of our medication and to answer questions on medications. Sometimes the medications are so new, the doctor just doesn't know everything about that medication yet. So every pharmaceutical rep is very highly trained.
Is that training from in-house, or do you go out of house to get some of this training?
It's all in-house, and it is also continuous. We always have new information coming, and we're always trained and studying on new information that may be available on new products or on established products.
Now, some clinics and some doctors have just stopped completely seeing sales reps.
Yes.
What's Pfizer's take on that?
Well, it's disappointing to think that there are patients in those clinics that could benefit from new medications or medications that may be more effective than older medications. And I think the healthcare industry works best when doctors have all the options available, when they have all the information available on all products that are on the market.
Now, outside of having just a no salesman can call kind of a thing on a door, how has your job changed in recent years?
It's changed tremendously. Medical technology has changed. Everything's computerized. Patients may notice that their doctor might not have a paper chart on them anymore. Everything I have is on the computer. And the information available to doctors is tremendous. It would be nearly impossible for them to keep up with all the journals and all the information, all the new medications that are out there. So it's my job to be as efficient as I can be with their time, with the patient's time, and present my information very efficiently and succinctly.
Now, if someone has closed the door on a sales rep, is that the end? Is that it? Or can you still, contact them and say, you really should, for these very reasons, be hearing what I have to say? I'm not here to sell you anything. Is it something you just keep going back to?
I do. I keep trying. I keep trying different avenues and ways to reach them, to let them know that there's a new medication available. There's a new study on an older medication available. There's something that they might want to hear about. And we have different ways that they can contact a rep too. It could be through the internet, and it could be through me. They may be aware that I'm out there with this medication and they can contact me. So I'm always trying.
Now, as we wrap things up here, what haven't I asked you about Pfizer that you'd like me to know?
I would like everyone to know that Pfizer is selling good medications. All pharmaceutical companies are selling good medications. There are many options out there for patients, and the healthcare industry works best when doctors have all the information and all the options available to them to choose the best medication for their patients. And we're really lucky here in Minnesota. We have many great physicians and clinics to go choose from.
Stephanie Schmidt is our guest here. I'm Dan Culhane from WCCO, and thank you for joining us today.
Thank you.